We will be discussing the entity of impulse control disorders, compulsive behaviors, and specifically how they impact the care partners and caregivers, and what is the role of the care partners in recognizing and managing these conditions. The entity of impulse control disorders, disinhibited behavior that can be manifested by as extreme as pathological gambling or disinhibited sexual behavior, overeating, over-shopping, and other compulsive trends in behavior, has come into the spotlight of non-motor manifestations of the disease over the last 5 years. And one of the reasons why we did not recognize them before is because the patients and their care partners were not comfortable coming up with the discussion of these problems, because frequently they're socially embarrassing and inappropriate, and we as physicians were not asking sufficient and appropriate questions to elicit that behavior. Now that the high frequency of impulse control disorders associated with Parkinson's in a majority of cases are precipitated by exposure to dopaminergic therapy has been well established, the question about presence of impulsivity or compulsive disorders has become the standard question in the physician's office when we interview patients with Parkinson's disease, which should substantially improve our ability to intervene in a timely fashion to result in improvement of the quality of life of people living with Parkinson's disease and their care partners. So, how should a care partner address the problem if they suspect that their loved one has developed one of these entities? First and foremost, it will be appropriate for you to have the discussion with a person with Parkinson's disease, bringing up the entity to their attention. Frequently the person will disregard it or will consider, oh, that is within my normal behavior, I can control it. But first and foremost, if you alert them and have the discussion and make them think whether their behavior has exceeded the scope of what you normally see or what their normal personality, they will think about it and bring it up to the physician. What if your significant other is not comfortable discussing the condition with you? Is that appropriate for you to communicate to the physician and to ask the advice? Absolutely so. You are not doing that quote-unquote behind the back of your loved one. You are observing the behavior that is outside of the scope of normal. From your standpoint, you've seen something unusual, different, happening with the normal behaviors or the daily routine of your significant other. It is most appropriate to bring it up in the conversation with the physician. I always advise the care partners to bring it up to the patient first, so that they don't feel quote-unquote left out or that some discussion is happening behind their back. The best scenario, if it is something not acute, is to come to the physician's next appointment and to have that discussion, to bring up that concern in presence of your loved one, in presence of the person with Parkinson's disease, to the physician, and to start the discussion. We have discussed that. I would like to know your opinion on the subject. That way, the person will not feel embarrassed, and you brought up the topic that definitely is very important to discuss. If it is something more acute, and the doctor's appointment is not coming up for a certain period of time, it certainly is appropriate to make a phone call to the physician to alert the physician some of these behaviors might be both socially inappropriate and carry significant social consequences, might result, if it is pathological gambling, overspending in other ways, obviously can result in depleting of the finances of the family, putting substantial strain on the family that could have been avoided if were appropriately addressed. Don't feel embarrassed. Don't feel uncomfortable to bring it up. We always say that Parkinson's is the disease of the family, which means that the care partners are active participants in the care plans, in the care decisions, and should be involved as such. Impulse control disorders are common in Parkinson's disease. In majority of cases have been precipitated by exposure to Parkinson's medications. Dopamine agonists, medications like Mirapax or Equip or Nupra, are more commonly associated with this entity rather than levodopa, Sinemet. However, all dopaminergic therapies have been implied in developing this condition. Accurate identification of the problem early on is essential for the effective therapy. Don't be uncomfortable. Discuss the problem if it is present with a physician.